So now it's Sarah or Sara. Which one is it?
Sarah.
Okay, thank you, Sarah.
Is this okay? Awesome. Hi, my name is Sarah. I'm a postdoc in biomedical engineering, and I'm going to be talking about something a little bit different, which is using ultrasound as an antibiotic. So, okay. We're probably familiar with biofilms, which confer both physical and functional protection to bacteria against antibiotics. And we, in my group and within kind of our program grant, hypothesized that acoustic cavitation, which is a result of ultrasound, can help disperse the bacterial biofilm. And so the goal of this work is to confirm, quantify, and optimize the role of cavitation in the biofilm removal process using a process called passive acoustic mapping, which I'll discuss in a few slides. So as background, cavitation is the expansion and rarefaction or compression of a bubble within a liquid. And we can easily facilitate this process by introducing bubbles. So microbubbles are clinically approved ultrasound contrast agents, and they are exactly what they sound like. They are micron-sized bubbles that are formed of a phospholipid monolayer surrounding an inert gas core. They're 1 to 10 microns in diameter, and under an ultrasound field, they can do all sorts of crazy things and have these really violent mechanical forces that can be harnessed therapeutically. So other people in my group have used bubbles to enhance drug delivery to tumors or to enhance the penetration of vaccines through the skin. And we're hypothesizing that they could also be used for breaking up bacterial infections. So passive acoustic mapping can be used to monitor this bubble activity in real time. So when the bubbles do that violent oscillation, they can emit ultrasound echoes that can then be received by an ultrasound device and characterized and quantified. And the way that this is done is because bubbles emit specific frequency signatures depending on how violently they oscillate. So when you increase the ultrasound pressure, you go from these really discrete harmonics and subharmonics, I guess, signal, and it moves into a signal that is comprised mainly of broadband elevated noise emissions. And we can use calibrated ultrasound arrays to be able to receive those emissions and turn them into realistic pressure and energy information, as well as use signal coherence and time of flight information to actually localize where they occur. So this could be a really useful technique for monitoring emissions and understanding how violent a ultrasound regime is in real time. So the setup that I've been using to evaluate this, I have a focus transducer that is aligned towards a culture dish where I grow biofilms in. Then I have an imaging array above to receive the cavitation emissions. I'm looking at 2 different cavitation nuclei, so bubbles that I talked about previously, as well as a novel agent developed by the group, which is made of protein. And the benefit of using these is that over repeated ultrasound inseminations, bubbles can be easily destroyed, but it's been shown that these little pecans, these cups, can sustain inertial cavitation and energy for a bit longer. So I was comparing the 2 agents, and then I was looking at 2 different bacterial species grown as biofilms, so a methicillin-resistant Staph aureus strain, as well as a Pseudomonas aeruginosa strain. And the biological readout was really just looking at surface area reduction evaluated on the microscopy images. So what I saw is that with increasing cavitation energy, and the x-axis here is just an integration of all of the received cavitation emissions over the exposure duration, and the y-axis is the reduction in biofilm presence determined through the microscopy images. As we can see, with more cavitation energy, we get more reduction in biofilm presence, which is dependent on the species. So we get more reduction in Pseudomonas species than we do in Staph, indicating that potentially more ultrasound dose is required to treat different types of infections. And if we look at differences between the 2 agents, these 2 examples, so 1.5 megapascal, so a higher pressure with bubbles versus a lower pressure with the cups, provide a similar amount of cavitation energy but result in different biological responses, which we attribute mainly to the persistence of the 2 different agents. And another thing that you can see here is that the way in which biofilms are removed from the surface depend also on the species. So Pseudomonas seems to be removed kind of in a layer, whereas Staph is removed on a cell-by-cell basis, it seems. So the other things that we can do with ultrasound is obviously localize where the cavitation emissions are happening. So we can look at both where the acoustic field predicts kind of the overall region of biofilm removal within this area. And then our cavitation image can also predict the width of biofilm removal by using cross-correlation to determine where these cavitation events are happening. And finally, we didn't see a difference so we removed the bacteria that were released through this process and recultured them to determine if there was any change in CFU as a result of, I guess, releasing the bacteria. And we didn't see any change, but I should say that there's a caveat that the exposure region was quite a bit smaller than the total region of the biofilm, so it's probably just not sensitive enough to fully determine this, so take this with a grain of salt. So in conclusion, we think that passive acoustic mapping may be used to quantify and predict the extent of biofilm removal. Different bacterial species may require a different cavitation dose to achieve complete removal. But I think it's promising that ultrasound cavitation could represent a novel form of debridement or antibiotic treatment for biofilms, and especially biofilms that are difficult to access within the body, such as those on implants or catheters. So no questions. I put that on there before I knew that I wouldn't have questions, but feel free to come find me afterwards if you have any. And thank you to all collaborators.